Rethink Healthcare. It's Wendy Ball and
Paul Montenegro.
oh, not Mr. Montenegro today.
Well, I figured they need to know my first name at some point.
Yes.
Yes.
Got to change it up a little bit.
P. Montenegro.
P. Montenegro. So
Did you know Montenegro is a country?
it is.
Yes.
I did not know that. Where
You
is
didn't know
it?
that? It's in Europe.
It is really?
Yeah.
Seriously?
I'm not kidding you.
Okay. Well, we'll have to go visit that country.
Montenegro, yes.
And for everybody out in Montenegro, hi.
I'm here.
So today we are talking about delegation.
You're good at that.
Yes, yes.
She always tells me what to do.
Yes, yes.
She tells me what to wear. She tells me where to sit.
Yeah, women are just, good
Delegators.
delegators. We are
Yes.
not bossy.
Yeah.
Not at all. We're just good
No.
at delegating and getting tasks done.
I
So,
just tell my wife, yes, dear.
yes,
What would you like?
that your
Yes.
wife must love that.
Of course.
Yes.
Yes.
Good husband just says,
Yes, dear.
yes, dear. But seriously, we are talking about delegation in healthcare. So,
Okay.
what does that even mean?
Delegation is really more assigning either a task
Okay.
or a role to somebody.
Okay.
So I guess when it comes to a delegation perspective, right, you need to know what you're delegating appropriate.
So I can't, delegate somebody to do something that they can't do?
For example, right,
Okay.
if you're in the healthcare setting and there's a certified nursing assistant, you're not able to delegate them to give a medication.
Okay.
It's not within their licensure.
Okay. They got to know the scope of practice. So the person themselves needs to know their scope of practice. So if somebody delegates to you something you can't do, you can say, that's not my scope. But also the person delegating absolutely needs to know
also know, yes.
what they can and cannot delegate.
Now, the person delegating may not necessarily know the intricacies of those, but the person being delegated to needs to be fully, duly aware of what you're allowed to do.
How do they know what they're allowed to do?
It's the State Practice Act.
Oh, of course, that State Practice Act.
Exactly, and it varies in different states.
It does.
I mean, so let's say for LPNs, right? You're maybe allowed to do certain things in certain states. So for example, like I know there's no IV pushes, but some states may not even allow you to replace an IV bag. Again, it depends on the state itself. As nurse practitioners, we have limitations as well into what we can do.
Okay.
So I need to be acutely aware, depending on what state I'm in, and I'm licensed in multiple states, what am I allowed to do? Your practice protocols, like for us as nurse practitioners, will vary. So I need to be aware. I need to know what medications are appropriate in my practice protocol.
Yeah.
So
I even tell my students that they need to know what they can do in their state, but they also need to know what their facility allows them to do, because the facility can't let you do anything that the state's not saying you can do. But they may limit what you can do, and maybe that the state allows you to do something, but that facility says not in this facility. So you have to know the state and what they say goes.
Yes.
But then in your facility, if they don't let you allow you to do something, we have to know that too.
Of course, yeah.
Yeah,
And
yeah.
each institution will have their own policies on what you're allowed to do and how to do it. So you need to be also acutely aware of those.
Okay, so who tells who what to do? Let's talk about that.
I guess we have to look at the hierarchy in the healthcare system. So you want to start from
The top? Yeah, let's work our way
top down?
down. Okay.
from so your physicians are
Okay.
have the pretty high authority when it comes to managing patient care. Then you have your physician assistants, you have your nurse practitioners. Those are there as well. Then you have your registered nurses, and then from there, from a licensure perspective, you have your licensed practical nurses. Then you have your certified nursing aides. You also have other providers like respiratory therapists. You may have your physical therapists, occupational therapists. So those are other members of the healthcare team. But in the nursing world,
You can even have like patient care techs and
like a patient care
medical
technician.
assistant
Yeah.
and stuff like
So
that.
those are all
certification.
Yeah, they're non-licensed roles, and you have to be acutely aware of what they can and cannot do. Bottom line here, I mean, if you're not licensed, you're not allowed to pass a medication. Even if it's an over-the-counter medication,
Yes.
it's not allowed in these settings. Yes, at home you could just take it, but that's different. Mind you as well, I mean, at least here in the United States, because we have international viewers, if you're in the hospital or long-term care setting, you're not allowed to keep your own medication, even if it's over-the-counter. It has to be all within the nurse's purview. But why is it that? Because we need to know what you're taking.
Yeah, it could interact with something else that's
For
new
sure.
that you don't even know that it interacts
Yeah,
with.
yeah, for
Or
sure.
they could be giving you something else that's kind of the same thing.
Exactly.
And
Then you have duplication, you have overdose,
Yeah.
overdose issues. But back to delegations. I mean, is there any specific issues that you feel our viewers need to know? I mean, for like your students, I mean, what is it that you want to drive home to them?
Yeah, I think as a healthcare professional, sometimes people are going to tell you what to do, right? And that we have to be accepting of. If they delegate an assignment to an LPN, they need to take that assignment, right? Is there a time when something's delegated where they could say no? Besides if it's out of their scope of practice.
Yeah, number one, scope of practice is number one. As nurses or nurses LPNs, if you feel that what's ordered to you to do is not right for the patient, you have the right to be a patient advocate.
Yes.
If you feel that the order given by the nurse practitioner, physician assistant, or doctor, if you feel that that's not the right order, or you truly believe that this could harm the patient, you have your own license to protect, and you could act as the patient advocate. Then from there, you just kind of go up the line, up the chain, and decide if
Yeah, like if a doctor tells you to give a medication and that person's allergic to the medication, right?
Yeah.
It doesn't have to be, well, the doctor told me to do it. You are also responsible.
You'll be culpable, yeah. If you administer it, you'll be culpable for if there's a reaction. I know I've had nurses tell doctors no, they have an allergy, and the doctor says no, they still want you to give it. The nurse will say no, then you give it if you want them to have it. So
you have to protect your license also.
Yes. So from a delegation perspective, really know. But those are more orders. I mean, you also have to look at
orders.
Yeah. You also have to look at delegation from working within a team. So, for example, like you're in a nursing home setting, and you get your assignments for the day. The nurse could delegate. The registered nurse could delegate to the LPNs. Okay, you guys take care of the medication passes. You take care of the wound care. And then this is the assignments for the CNA. I mean, that's usually your shift roles to that. In that setting, the registered nurse is kind of calling the shots. I remember in the hospital, I mean, when I worked in the med-surg floor, as soon as you took assignment, you knew who your team was. As a nurse, you would decide, okay, who's the priority patients that you have to see, right? And then from there, if you have other members working with you, let's say your CNA or an LPN working with you, then you could then assign to the LPN, okay, these are the patients that I'd like you to be responsible for. That's the registered nurse's call on what they feel is going to be important.
Yeah, delegating like on even Maslow's hierarchy, like who is the most important to see?
Like,
what is the task we need to get done first?
Exactly. I mean, as a registered nurse, if you're going to be delegating, make sure that you're delegating appropriately. I mean, if you know that the LPN is not able to hang blood and somebody is ordered a blood transfusion, why would you bother giving that patient to the LPN?
Or if you have an LPN or even a new nurse that's a new hire, we might think of how we're going to delegate that assignment. Maybe we're not going to give them as such a heavy load because they're new, they're still learning.
Or from like an acuity perspective, they need, you need to really be careful. Or somebody who's really a fresh post-operative patient that needs more current, more routine assessments. You also have to look at your team and get the comfort level of your team. If somebody's not comfortable managing a certain procedure, there's no point in giving it to them. Now, from a learning perspective, you could work with them and do it together, so they gain knowledge, right? But there's no sense in making that to be their primary load.
How about the LPN? Can the LPN delegate to anybody?
Of course, yes. The LPN should be able to look within their own team. They work with the nurses' aides, so they could delegate tasks to the nurses' aides.
And sometimes the LPN might be actually the nurse manager
Of course, yeah.
on that long-term care facility.
Yeah. So as an LPN, you have to also look within your team, and there's no reason wherein an LPN couldn't delegate up above their chain. So if you're the LPN and you're really, really very busy and you have a lot really going on, but then you have, let's say, a RN manager who's there but was just doing paperwork. Well, what's more important, the paperwork or the patient care? Feel free to reach out to say, hey, you know what? I'm getting behind now. These patients, these need to be done for these patients. Can you give me a hand? You're not necessarily delegating to them, but you're
asking
free to ask. Exactly. Yeah, there's no problem with that. You know, I mean, even with me as a nurse practitioner, if I'm doing my rounds and somebody needs help boosting up a patient, I mean, you don't have to stop and go and get it seen. I mean, I'm here. I'll go help you.
Absolutely.
Let's just get it done now.
Yeah.
So why do that?
So what are we rethinking about this?
So I think from the rethinking of the delegation part, it's just really more the comfort on what is it that you just think of it as a team.
I think that's a good team approach.
Yeah, a good team approach, but then also within that team approach, knowing what's within your scope of practice.
Okay, so know your scope. I think that's kind of...
And know your team.
And know your team. Okay,
All
that's
right.
a wrap.
Thank you. Bye.